Hello everyone, my name is Maliha Hokshima and today I am going to talk about thoracic cavity. Thoracic cavity is also called chest cavity, which is the second largest hollow space of the body. The thoracic cavity is the anterior vertebral body cavity found within the rib cage in the torso. It houses the primary organs of the cardiovascular and respiratory system, such as the heart and lungs, but also includes organs from other systems, such as esophagus and thymus gland. Chest cavity enclosed by the 12 pairs of ribs and sternum anteriorly, vertebral column posteriorly, and inferiorly by the diaphragm. It contains the lungs and bronchi, part of the esophagus and trachea, and the heart and major blood vessels. The chest cavity can be divided into a middle partition called the mediastinum and the laterally placed pleura and lungs. Mediastinum. The mediastinum lies between the right and left pleura in and near the middle sagittal plane of the chest. It extends from the sternum in front to the vertebral column behind and contains all the thoracic viscera excepting the lungs. It extends superiorly to the thoracic outlet and the root of the neck and inferiorly to the diaphragm. It is divided into superior and inferior mediastinal plane, passing backwards horizontally from the angle of Lewis to the vertebral column. The inferior mediastinum is subdivided into medial mediastinum, anterior mediastinum, and posterior mediastinum. Superior mediastinum. The superior mediastinum is bounded in front by manubrium sterni and behind by the first four thoracic vertebrae. Like anteriorly there is manubrium sterni, posteriorly T1 to T4, sides mediastinal pleura, superiorly plane of thoracic inlet, inferiorly imaginary line joining sternal angle and lower border of T4. There is a muscles called sternothyroid, longus colli. Inferior mediastinum. The inferior mediastinum is bounded in front by the body of the sternum and behind by the lower 8 thoracic vertebrae. The inferior mediastinum is subdivided into anterior mediastinum, posterior mediastinum, and middle mediastinum. In the anterior mediastinum, it consists of the pericardium and heart. Posterior mediastinum, the region between the pericardium and vertebra. Middle mediastinum is the pericardium, phrenic artery, pericardico-phrenic artery, heart, and the great vessels. Posterior mediastinum is consists of esophagus, thoracic duct, arterial duct, descending aorta with its branch, veins, azygos, hemiazygos, and accessory hemiazygos, nerves, vagos, and splenic nerve. Lymph nodes, posterior mediastinal. Pleura. Pleura is a thin covering serous membrane that protects the lung. It is lining for the chest cavity. Each pleura consists of two layers, the visceral layers and the parietal layer. The visceral layer, which is adherent to the lungs, and the parietal layer, which lines the inner aspect of the chest wall, diaphragm, and mediastinum. The parietal and visceral layers of the pleura are separated from one another by a slit-like space, which is called pleural cavity. The pleural cavity contains a small amount of pleural fluids, which acts as a lubricant, descending friction between the pleura. The costal pleura lines the inner surfaces of the ribs, the costal cartilages, the intercostal space, the sides of the vertebral bodies, and the back of the sternum. The diaphragmic pleura covers the thoracic surface of the diaphragm. The mediastinal pleura covers and forms the lateral boundaries of the mediastinum. Pleural blood supply. Visceral pleura arteries supplied by bronchial and pulmonary artery systems. The parietal pleura artery supply is from various systemic arterial supply to the arterial supply of chest wall, diaphragm, and mediastinum. Pleura venous drainage. Visceral pleura veins drain in pulmonary vein. The parietal pleura through the intercostal veins which empty into the inferior vena cava or bronchocephalic tract. Pleural nerve supply. The parietal pleura is sensitive to pain, temperature, touch, and pressure. The parietal pleura is innervated by both somatic and sympathetic fiber via the intercostal nerve. The parietal pleura is supplied as follows. The costal pleura is segmentally supplied by the intercostal nerves. The mediastinal pleura is supplied by the phrenic nerve. The diaphragmatic pleura is supplied over the domes by the phrenic nerve and around the periphery by the lower 6 intercostal nerves. Thank you so much.